Hello, my name is Lynn. I will be presenting my capstone project today. For my capstone project, I choose to focus on improving health literacy in hospitalized patients with heart failure through nurse-led teach-back education throughout my nursing experience on both medical and surgical progressive units. I've cared for many patients with heart failure who received a large amount of discharge education, but still struggle to explain the medication, recognize worsening symptoms, or describe what they should do once they return home. Unfortunately, this problem creates a revolving door of frequent flyers who continue to return to the hospital for readmission. These repeated hospitalization increase opportunities for patients to develop hospital-acquired conditions such as pneumonia, central line-associated infections, or catheter-associated infections. This can further worsen their overall health status and add additional complications to an already complex chronic condition. As a bedside nurse, I have seen firsthand how difficult it can be for patients to manage heart failure after discharge. This experience inspired me to focus on improving patient care, patient understanding, rather than simply providing more information. These objectives focus on what the audience should learn from the presentation. My project examined how healthcare literacy affect heart failure outcomes and how teach-back education may improve patient understanding and self-management. I will also discuss the proposed intervention, outcome measures, and how the PDSA framework can be used to guide implementation and evaluation. So, heart failure patients often receive education about medication, daily weights, nutrition alterations, sodium restrictions, symptom monitoring, and follow-up appointments. Even with education, many patients leave the hospital without fully understanding how to manage their condition at home. I've personally seen patients return to the hospital because they were unable to recognize worsening symptoms or manage the medication correctly. With reinforcement, according to AHRQ, patients often leave healthcare settings without fully understanding the importance of health information. So for my aim statement, by December 2026, increase successful teach-back demonstration among hospitalized heart failure patients from 50 to 80% through nurse-led teach-back education and medication card. According to the Institute of Healthcare Improvement, the model of improvement uses measurement to determine whether changes lead to improvement. This project will use PDSA framework. Teach-back education will be incorporated throughout hospitalization instead of waiting until discharge. Medication cards will provide an additional tool to help patients understand common heart failure medication and their purpose. One of the main concerns for education are the medical jargon that would confuse patients. So these medication cards will be straightforward and written in simple, plain language to help reduce confusion. So for the project plan, education will focus on medication, symptom recognition, daily weights, fluid restriction, diet alteration, and when to seek medical care. Family members or caregivers will also be included whenever possible because they are the one often to help manage care after discharge. Education can be divided into smaller topics throughout the hospitalization rather than providing all information at discharge. This may help reduce information overload and improve retention. Before introducing a new topic, the nurse will ask the patient to explain previously discussed information using the teach-back method. This allows the nurse to reinforce key concepts, identify knowledge gap, and clarify misunderstanding before moving on to additional education. Medication card will serve as a supplemental education tool and provide patient with a simple reference they can look back to after discharge. The medication card will be straightforward and written in simple languages to reduce confusion. The hospital where I work serves a large Latino population, so cultural and language consideration are important. If the medication cards are shown to be effective, a future goal would be to develop Spanish versions to improve accessibility and better meet the needs of our patient population. Ultimately, the goal would be to create medication cards that can be printed in multiple languages so patient can receive education in the language they are most comfortable reading and understanding. So for a proposed intervention, according to BMC cardiovascular disorder, teach-back education improves self-care behaviors and quality of life in health failure patient. Teach-back allow nurses to assess understanding by having patients explain information back in their own words. Medication card may help simplify complex medication regimen and improve retention of information. As you can see in this medication card, it shows a list of anticoagulant medications. These are the most common ones that are often seen taken by patients. So when patients look at these cards as a reference, not only are they constantly seeing the name, the brand name, and generic of the medication they're taking, this would also be a good way for them to remember the medication they take, since that is really something that a lot of people struggle with, especially the name of the medication. This card also provides helpful information so patients understand why they are taking the medication, why it's important, and like the side effects. This card also shows the difference between DVT and PE in very plain language. And when patients see things like clots in lung or clots in leg instead of DVT or PE, it provides them with the knowledge of why they're taking the medication, and therefore will be more willing to be compliant with the medication, and in effect will have less readmission issues. If these interventions prove effective, a future implementation could involve incorporating medication cards into the medication administration process. Patient could use the card to identify their medication, explain their purpose, and describe when they should be taken during scheduled medication administration time. This would create additional opportunities for teach-back, reinforce learning through the hospitalization, and help nurses assess patient understanding in real time. This will also condition the patient to actually take the medication around the same time that they do in the hospital, which will help with compliancy as well. The goal is to move beyond simply providing education and ensure patients are actively participating, learning how to manage their medication before discharge. All right, for measures and evaluation, success will be measured by whether a patient can accurately explain their medication, identify worsening symptoms, and describe how they will manage their condition after discharge. According to the Institute of Healthcare Improvement, measurement is necessary to determine whether improvement has occurred. Process measures will include the number of patients who receive teach-back education and medication cards during hospitalization. Outcome measures will focus on patient understanding, including medication knowledge, symptom recognition, and self-management skills. For long-term evaluation, the unit can track patients who receive the intervention and monitor for repeat hospitalization, especially related to heart failure. Comparing readmission trends before and after implementation may help determine whether improved health literacy and teach-back education contribute to better patient outcome and reduce readmission time. According to the International Journal of Nursing Studies, patient education can be challenging when patients receive large amount of information during hospitalization. Patients are often overwhelmed by the amount of information they receive before discharge. Time constraints and competing priorities may also affect implementation of patient education. However, teach-back can be incorporated into existing education practices without requiring significant additional resources. This is why it is important to implement teach-back through the patient's hospitalization rather than waiting until discharge. Education should be broken down into smaller topics each day to reduce information overload and improve retention. Reinforcement of previously discussed topics should also be incorporated to ensure patients are truly understanding the information being provided. This approach allows nurses to identify gaps in knowledge, addresses misunderstanding, and better prepare patients to successfully manage their condition after discharge. This type of practice change require support from both leadership and upper management. It is important for leaders to actively support the intervention and advocate for its value to both staff and patients. When leadership is engaged and visibly supportive, staff may feel more comfortable adapting new practices and incorporating teach-back education into their daily workflow. Strong leadership support will also help address barriers, provide necessary resources, and improve the long-term sustainability of the intervention. These literature consistently support the relationship between health literacy and patient outcome in heart failure patient. Linescu et al. Found that limited health literacy is associated with poor self-management and worse clinical outcome. Several studies also support that use of teach-back as an effective educational strategy. O et al. Demonstrated improvement in patient understanding and discharge readiness, while Zara Kassab et al. Found improvement in self-care behavior and quality of life. Longhini et al. Further show that nurse-led education intervention can strengthen self-management in patients with heart failure. Together, these findings support the use of teach-back education and medication card as practical intervention to improve health literacy and patient outcome. In conclusion, my capstone project focused on improving health literacy in hospitalized patients with heart failure through nurse-led teach-back education and medication card. Rather than waiting until discharge, education should occur throughout the patient's hospitalization using small, manageable teaching sessions with frequent reinforcement. This approach allows nurses to verify patients' understanding before introducing new information and help reduce the feeling of being overwhelmed at discharge. Although implementing a practice change requires support from leadership and staff, I believe this intervention is realistic because it builds upon education that nurses already provide every day. If successful, this project has the potential to improve patient understanding, strengthen self-management, and ultimately reduce preventable hospital readmission. More importantly, it empowers patient and family members to feel confident in managing their condition after they leave the hospital. Thank you and have a good day. Bye-bye.